Good afternoon, everyone. Today we will celebrate this month. May is the Lupus Awareness Month, and we're doing this Facebook live chat to talk to you about lupus. We're going to discuss this with one of my patients. I am Kyriakos Kirou, MD, rheumatologist at HSS, Hospital for Special Surgery in New York City. I'm specializing in lupus and also in the management of lupus nephritis. I'm also an investigator, and we're doing here clinical trials in lupus and translational research in lupus. HSS, Hospital for Special Surgery, is the hospital that deals with orthopedic and rheumatology issues such as lupus. So we care a lot about our patients with lupus here. Sam is my patient.
Hi.
Thank you for coming.
Yes. Thank you, Dr. Kirou. My name is Sam. I am a patient of Dr. Kirou here at the Hospital for Special Surgery. I came here December of 2014. Didn't have a diagnosis of lupus for several months. Originally, I was at the hospital, at another hospital in September of 2014. Originally, they thought it was lymphoma, if you remember correctly. But thankfully, after 2 tests, it did not confirm it, if you remember correctly, and then my uncle recommended I come to the Hospital for Special Surgery to see you. It was the week of Christmas, if I remember correctly, and that's where we started. That's where we started. That's where I was diagnosed.
So that's very important what you're saying, because you're talking about an important issue. How do we make the diagnosis of lupus? And in fact, many patients take a lot of time with their doctors before they arrive at the correct diagnosis, and that's very important, because when you know what you're dealing with, you can deal with it better and get the right treatment faster, which is very important in terms of the outcome, get the best outcome possible. But before we go into those details, I just wanted to talk about lupus in general. So lupus is a systemic autoimmune disease, which means that the whole body can be affected. Autoimmune means that our immune system, for whatever reason, becomes overactivated, and instead of targeting infections or cancer, it actually targets ourselves, our healthy tissues. One of the diagnostic antibodies that we use for lupus, it's called the anti-nuclear antibody ANA test. And that is another testimony that those antibodies can target anything. So nucleic material is in all cells of the body. So therefore, you can have those antibodies attacking your joints and have arthritis, the kidneys and have nephritis, the skin and have skin rash, lupus dermatitis. So the diagnosis takes time, as we said, sometimes because the symptoms are so diverse. People can have symptoms from all body organs. They may present with fever, with fatigue, fogginess, so many symptoms, and somebody has to put them together and make the right diagnosis. So for that, some of the tests are helpful. The ANA test is very helpful, because if you don't have it, if it's negative, it essentially rules out lupus. If it's positive, it's not does not necessarily mean that somebody has lupus. So we need additional testing, and eventually it's the combination of clinical symptoms and serologic tests that confirm the diagnosis. And then after that, we have to manage the patient correctly, and we have several treatment options to deal with lupus. Some of the medications we use is hydroxychloroquine. Hydroxychloroquine is an anti-malarial, and it's relatively benign. It doesn't cause immunosuppression. Meaning that it doesn't cause weakening of your immune system and sensitivity to infections, but it helps, and it helps with the skin, with fatigue. It helps with sometimes also lowering cholesterol, the arthritis. So Plaquenil is our first usually medication we use. We also use steroids although we try to avoid them, they have many side effects. We have to use them sometimes, and when we use them, we try to use them the right way. So for short time, with the right dose, so that the patient can feel better, and then we taper them off. We use also other medications such as mycophenolate, which is an immunosuppressive, to regulate the immune system, which is very active at that point for lupus patients. Another medication might be azathioprine, and many more. We also have more recently biologic medications, which are specific medications that target certain very important pathogenic substances. For example, benlimumab is the generic name. Benlimumab is an antibody that we developed lately in lupus, and that blocks something called BLyS, B lymphocyte stimulator protein, and that protein actually activates B cells to produce antibodies. So B cells are cells, immune cells in our body that produce antibodies. So in the case of lupus, they produce too many autoantibodies, and by blocking their nutrient kind of cytokine called BLyS, we downregulate their activity, and that helps lupus actually. So we have ways to deal with lupus, and we have more knowledge about lupus, and I think what's important, as we will talk about next, is the collaboration and working together with our patients to get the best outcomes. So can you tell us a little bit, Sam, so you remember how you felt in the beginning, and how long it took you to feel better, and how was that process?
Well, when I first came to see you back in December 2014, I mean, I was in really bad shape. I mean, I could barely walk. Getting here was a tough ordeal. If you remember, my parents literally were holding me side by side to get to the hospital, and when you first saw me, I was very weak. I had lost, I think, summer of 2014, I think I was about 230 pounds, and then by then I was about 170 pounds by the end of the year. So I was very weak, at times lethargic, just wanted to sleep all day. And the first thing that I remember was you communicated out to me what lupus is, which is very important from a patient-doctor relationship, is to communicate with your doctor, and you reciprocating that back, understanding what lupus is. And I remember you telling me about your philosophy and strategy, how to treat this. It was really bad, if I remember correctly. I think you said it was a 10 out of 10. I think you said it was a 12. It was that bad. And your philosophy was to hit it hard and be aggressive with it, because this is your one chance to knock it into remission, and hopefully we can. So that's how we first started, and there was a lot of appointments following, but I think you and I emailed and even spoke by phone quite a bit in the first 3 months. It probably took about 2 years to really regain back most of my strength, but also understanding lupus. There were certain things of my life and lifestyle that I had to change, such as diet, and obviously I consulted with you first about it. My diet, certain things about the photosensitivity, which, by the way, summer's coming, right? Remember your sunscreen for all the lupus patients out there. That's very important, because I do get affected by the sun, which I really didn't understand before I was diagnosed, but that now I take a conscious approach. Just the little things, having sunscreen clothing that would block it, about 95, 100%. every little bit helps, but everybody is different.
So you bring one point that I would like to make here. So lupus can have triggers. So lupus is a genetic disease in one way. So it's not like a Mendelian genetic disease where one gene decides that somebody gets the disease or not. But so, for example, 5% of the patients with a first-degree relative with lupus might get lupus as well. So it's not a very high number. So there's a genetic component, and then there are triggers, and those are the sun. So UVA and UVB light can cause skin damage. The skin damage releases nucleic material, and sometimes this works like a trigger for the immune system to act up. Also infections, which we cannot control, I guess, many times, but infections can trigger lupus as well. I guess just to talk about infections just for a short time, is that one way, I guess, to limit infection is to be careful when we go out, wash our hands, but also get the vaccinations that need to be done. For example, the influenza vaccine is important, and sometimes we do the pneumonia vaccine also for people who have strong immunosuppression regimens. So all of those are things that hopefully are easy to control. We can do the sunscreen, make sure it's more than 35 grade, covers UVA and UVB light, and apply it frequently, and avoid to go out in the bright sun in the days. So that's one point. So avoiding the triggers, and the communication that you mentioned is really important, because we shouldn't leave any questions unanswered. We should communicate, doctors and patients together, and try to understand, is the symptoms due to lupus, due to a complication, or something else, so that we can best take care of it. Another thing I think that I implied when I said hit it hard is give you strong medicine in the beginning, but also try to cover complications. So I think we were worried about your bones, and we wanted to be very careful with vitamin D supplements, calcium supplements, and make sure making sure if somebody has diabetes. Obviously, in your case, you didn't have that, but control that as well. And there are so many other things. And then be very aggressive of coming down on the medication. So after you're okay, the steroids many times cause people to be very swollen, puffy, and they can cause osteoporosis, infections, other things. So we want to taper them down as soon as we can. So that's, I guess, another important aspect of what we do. So yeah, more recently, I think it's the communication is easier with the electronic record and the portal we use, so that makes it easy.
It makes it really easy, and it documents everything. The other thing I would like to add that helps as well is managing your stress and getting enough sleep. I tend to work a lot of hours, and the one thing I've learned through trial and error is that you can't get away with not sleeping. Even if for a few, if there are times where, like last night, I only got a few hours of sleep, you have to make sure that you get your sleep in, whether you take the occasional nap or know when to say no and rest. Because by doing that, it's easier to manage some of the flare-ups, the symptoms, the fatigue. Sometimes I feel the fatigue where I just literally can't work today, and it's okay, and it's understandable. And if you could do it, it's okay to take a mulligan and take a day off. Sometimes I have to do that because there are days where I would work 6 days in a row, but I need my rest, and I would have to take a couple days off, just to recover a little bit.
So it looks like we have a question from the audience.
Dr. Kirou, how often are men diagnosed with lupus? Is there a difference in treatment between men and women?
Okay, thank you for the question. Actually, I was going to say that. So yeah, Samuel is a man, and so that's unusual. Most of the time, women have the disease. It's approximately 9-to-1 ratio women to men, and these are usually women of reproductive age. The ratio is a little bit less in girls before the menstruation, so there may be 3 to 1 at that point, female to men, and maybe a little postmenopausal also a little bit less than 9 to 1 ratio. So that can be due to different factors that we don't understand all the time. One of them is hormones, so obviously estrogen may play a role here. Having the second X chromosome is important, and probably other factors as well. It looks like although men have the disease less often, they may get it more intensely. So maybe lupus is more severe in men sometimes. So that's one of the differences. Otherwise, we treat the disease in the two sexes, genders, the same way. So yeah, obviously one issue is in women is fertility and pregnancy, but that's specific to the gender. Otherwise, we have good results with both men and women. So yes. We have another question.
So one more. Dr. Kirou, what questions are most commonly asked of the physician during a visit? And Sam, could you share some of the questions that you initially had during your first
So
Would you go first?
I guess sometimes it's a question that you don't hear, but you can read it in the face of the patient. When is their first time when they face this diagnosis? They feel like it's going to be devastating, and I guess they often they may ask me eventually, do I really have this disease? Will it go away ever? How will I feel? Will I be debilitated? So I think those are important questions that we need to understand. So although lupus can be sometimes very severe, in many cases it's not, and it's very easy to manage. So the important factor here is communication, going to appointments, and understanding the symptoms, understanding the medications, and I think most of the time that works very well for patients. So I think the worst outcomes are with patients who are in denial, and they don't accept the disease, and they don't go along with recommendations. Samuel, what are your...
Well, you make a great point, because the first thing I said when you diagnosed me with lupus, believe it or not, is the simple question: what is lupus? How did I get it? Is there a cure? And it all goes back to that patient-doctor communication. You answered all those questions for me, and you have to talk to your doctor, and you have to listen to your doctor, because I'm going to tell you, I'm guilty of this in the beginning. I started reading what was lupus on the internet, and it's scary what's out there, what you read, but your doctor knows best, and that's why I always came to you about, okay, how severe is my lupus, what exactly the type of lupus I have, what I should be avoiding, what's the treatment plan, how are we going to attack it. You should really concentrate on that versus how scary the disease is. Yeah. Other than that, I heard lupus, the disease, through a movie back in the 1980s, a long time ago. Back then, I guess, in the movie, the patient died, and that's scary. But with you, when we talked about it, I was confident that the strategies that were involved were to help me, overcome a lot of these symptoms. And I think the key word was manageable. How do we manage it? So that but to answer the question, what were my questions? I didn't know anything about the disease, whatsoever. But I asked a lot of those simple questions with my doctor, because my doctor knows exactly what the treatment plan is and what to do.
We have another question.
Kiana Alexander asks, what advice would you give for lupus patients? Would you recommend supplements, healthy diet, or to not break down your body?
Okay, so healthy diet is really important. Healthy lifestyle, so exercising is a good idea. Although again, sometimes it's going to be difficult, especially in the beginning. If there is a lot of inflammation, people may feel a lot of fatigue, joint pain, they may not be able to exercise. But it's important to, whenever the time is ready to start exercising a little bit with aerobic exercise, even as little as 5 minutes, 3 times a week. It's important to do the start, and then things will get better. With the diet, healthy, there's no specific foods that somebody really, we know that they need to avoid, but avoiding too much meat perhaps is a good idea. And then some people, calories are important. Avoiding too many calories, just keep the weight stable, because with the steroids, the prednisone, we tend to gain weight. So I think that's another important thing, to avoid gaining weight. Some people say gluten-free diet. We don't have a good evidence that this really works, but many patients say that that's a good idea. Yeah, I think avoiding things that we don't know. Always check for supplements. Always check with the doctor. Vitamin D is another important thing. Often, I would say 90% of my patients, the vitamin D level is low. And I think that's important, because vitamin D is easy to get, and it really helps the body in many ways, in terms of bone health, muscle health, and the immune system. So actually, it may help downregulate the immune system a little bit. So again, these are not all the time scientifically proven, but we have some evidence that this is true, and it works, in my experience. Yes.
Yeah, I mean, what I find to be helpful for me, and I guess, I always consult with you before, I go on a certain diet. I find that green leaf vegetables help, such as kale, spinach, anything green, Brussels sprouts, that seems to help quite a bit. But I also found that avocado helps me, with some of the inflammation. But a rule of thumb, I guess, is try not to eat junk, like refined sugars, like soda, alcohol. I mean, I refrain from alcohol completely, because I just don't want to, take that risk where it may trigger a flare.
Yeah.
So
hydration is important, right?
Yes.
Especially in the summer now. Drinking a lot of fluids, a lot of water is really important, so that helps. There are also, just because many questions are coming to that point, what is out there, what resources do we have? We have at HSS, but also lupus foundations have information about lupus, what to do. We have a lupus app here at the Hospital for Special Surgery, the Lupus Minder app. So that helps people manage their disease a little better, control their medicines, their symptoms, and they may actually show their doctor some of those symptoms they have, their medications. So those things help. We have social work programs at the Hospital for Special Surgery, where we have a lupus line. So these are lupus patients that reach out, and they talk to their peers. So they tell them about their experience, how they manage their disease. So I think these are all very helpful. They also have programs for Spanish-speaking or Chinese-speaking people. We have a workshop where people come here and learn about different aspects of managing lupus. So there are many resources actually right now. And it used to be that lupus was a terrible disease in the 50s, 60s, with high morbidity, mortality. Nowadays, with modern medicine, I think things are much better, and we used to see better outcomes these days.
Yeah, I downloaded the Lupus Minder app the other day. I went through it. Again, it's all about managing, and a lot of it is kind of like a diary of how you're feeling today. What you've eaten, that kind of thing. So every bit helps in managing managing lupus.
So just remember now, when you were talking about your disease, how difficult it was for you. They were thinking about lymphoma. You were so weak and so on. So we treated you with an aggressive, regimen of immunosuppression and steroids. And I remember you developed kidney disease at some point. And although this is usually a bad complication. It needs special attention. In your case, it was very easy to manage because you were already on the right medicines. It was just a time lag. It just happened right after you were on the right medication, and it went away really quickly. Within a few months, we didn't need to do any kidney biopsy or anything like that. It went very well.
Yeah, that was a scary moment because we weren't sure what was going on with the kidneys, and I think I remember you telling me, yeah, thank goodness that you were on the prednisone when you were. Otherwise, it could have been a different outcome if it was within a few weeks. So, and that's important to tell the audience about that. That don't delay seeing a doctor for this. Don't be in denial. Your doctor knows a lot more than you do, and there's a lot of research and science, behind it. And listen to your doctor. Whatever your doctor tells you to do, I would definitely do it.
One thing that I remember about you is the strong support you had with your family. So your parents came with you the first time, then I remember your future wife and wife now. And I think that's very important, right? What do you say about that?
Well,
how important is for the patient psychologically and otherwise to get supported?
to tell you the truth, at first I didn't know what to do, but why hide it? Everybody knew that I was sick.
Yeah.
Why hide it? And to communicate it out that there are days that you're going to have bad days, and I, some of my colleagues, they know that I have lupus, and I would literally tell them, hey, I need to take a mulligan for a day or two, and no questions asked. I would have a couple days off to just rest and recuperate, and then I feel better. But yeah, a strong support system is key, and I like the fact that the HSS, they have some kind of peer-to-peer with other lupus patients to see how they manage lupus. I think that's helpful.
And now that we celebrate Lupus Awareness Month, I guess when people are more aware about lupus, then they will know when a family member has lupus, and they'll be more sensitive to their needs, and they'll be able to help better. We have a question actually from the audience.
So Sam, how do you feel today compared to when you were first diagnosed in 2014?
Oh, a lot better. A lot better. I mean, I literally was sleeping almost 24 hours a day. I mean, if it wasn't, at the time, now she's my wife, if it wasn't for her, I probably would have seen a doctor. I was one of those people that was in denial, but you have to trust your doctor and trust the treatment plan that's given to you, and you got to follow it completely, making sure you take your medications on time, with food or without food, whatever your doctor directs you to do. I highly suggest you do that, because I'm living proof that I'm back to my original weight, maybe a little bit overweight, but I'm back to my original weight. I'm able to do the things that I'm able to do, and but I caution, I make sure that I stay out of the sun, and when I'm in the sun, I have sunscreen on, and I keep up with my diet as best as I can. I know it's tough, but I definitely I do my best, the best I can, to answer the question.
Okay, so here we are coming to the end of this very interesting discussion. We talked today with Sam. Thank you, Sam, for coming. We talked about lupus, how the disease happens, what are the causes, how is it treated, how do we cope with it, and some of the points that came up is that lupus is a treatable disease. You can get better with lupus as long as you communicate with your doctors, and you take the necessary precautions, avoid the sun, take your medicines, eat a healthy diet, lead a healthy life, and ask questions. If some of you have more questions for us, feel free to leave a comment at the website or call us. Thank you very much.